Dr. Jere here with Mills Chiropractic and Wellness Center. And this month, as we move into February, we're going to focus mostly on the neck. However, part of the neck is discs. So what I wanted to do was talk a little bit about disc today. A lot of people hear of disc problems and they get fearful and all these things. And the cool thing about chiropractic is that we can help a lot of those. But today what I want to do is just kind of talk a little bit about what the disc is. And it's basically the cushion between, we have 24 movable vertebrae, and we have a cushion basically in between each one of those. And that cushion is really made up of a lot of different things, but two different kind of structures within one. There's an outer ring of the disc that's very fibrous and kind of like tendons, and I always kind of think of it like little bitty ropes that go back and forth and they crisscross as they work their way around. And then in the center there's like a jelly substance that's made up of water. And what's really cool and kind of the way we're designed is that as we compress down on that fluid pushes out. Well, as it pushes out into the disc, it actually makes the vertebrae separate, which, you know, I think is just such an amazing, cool design that downward pressure actually causes us to rise up, right? Well, one of the troubles with discs, though, is that they're surrounded by bone on the top and the bottom, and then that thick annulus on the sides, and so they don't get a very good blood supply. And so over time, what tends to happen, if you've ever been diagnosed with degenerative disc disease or heard of somebody with that, what happens is that fluid has reduced, or perhaps in some cases is completely dissolved out of there, and so there's not that jelly substance in the center that when we load, that pushes the disc out, which actually makes us taller again, right? And so you see those disc heights getting smaller and smaller as time. Now, there's a lot of reasons that occurs. And certainly aging is a factor. However, too many times we blame it solely on aging, right? It is a factor, but it's not the cause. And so what tends to happen is we oftentimes will end up with an injury, and which limits our movement of that particular joint, okay? And so they don't get a blood supply. So what they do is they require movement in order to pump nutrition in, pump waste products out. Well, if we're not moving, we're not pumping in that fluid, that water back into the disc. And so over time, it just gets smaller and smaller and smaller, which actually limits our movement more, which means that we lose more water, which means that it gets smaller. And it really starts this bad cycle, this downward trend. And that's the really cool thing about what we do as chiropractors is we restore that movement, get that joint unlocked so that it can start rehydrating itself and hopefully, you know, increase that disc size again. And so anyway, I'm like I said, we're going to focus mostly on the neck this month, but I wanted to spend a moment just kind of breaking down disc a little bit and kind of going over the structure of those. So whether we're talking about the neck, the mid back, or the low back, it's the same mechanism, okay? And so I hope you got something from today's discussion. Tune in next week as we dive deeper into some of the neck issues that kind of plague us as a society. So until next time, stay healthy and stay well.